Hello students, welcome to All About Nursing channel. So today's video is going to about ventilator associated pneumonia or VAP. So before knowing the VAP, VAP we all know that is ventilator associated pneumonia. So VAP is a lung infection or pneumonia that develops in a person who is on mechanical ventilator. Our healthcare team members should be extra careful to prevent the VAP. And a VAP infection could be fatal or it can lead to death. VAP is a type of lung infection that occurs in patients who are on mechanical ventilator to help them in breathing, and it typically develops 48 hours or more after the intubation. So basically after the intubation, after the 48 hours of intubation, or it can be after any times of it can be more also. Okay, it can be 42 48, or it can be 56 hours, it can be in 72 hours also. Okay, so irrespective of the timing after 48 hours of the intubation, basically the VAP. So it is a serious hospital acquired infection that can increase the length of hospital stay of the patient. So the causes of VAP. So VAP is due to the lower respiratory tract infection by this type of causative agent. So VAP, ventilator associated pneumonia, is developed by these type of causative agent. It can be bacteria, it can be any type of microorganism. So that goes to the lower respiratory tract and causes lower respiratory tract infection, and from there VAP will be developed. So the causative agents are Pseudomonas aeruginosa, Staphylococcus aureus, Klebsiella pneumoniae, and the Escherichia coli. And the risk factors: the patient who are prone to develop VAP, the patients are who are on prolonged mechanical ventilator patient, or a patient who needs re-intubation, means after extubation patient needs again the ventilator support. So again, so there is re-intubation is done, and from there again invasion of the microorganism can be happened, and it is more prone to that patient who are going to re-intubate it. So those patients have more chance to develop VAP. And the supine position, so patient who are in mechanical ventilator, if the patient is kept in supine position, so those that can cause aspiration pneumonia. Okay, so inadequate hand hygiene, so during care of mechanical ventilated patient, mainly during suctioning, or during care of oral care, or during any type of invasive care to the patient. So if there is no hand hygiene, so that can if there is no maintenance of aseptic technique or hand hygiene, so that can lead to development of VAP. And presence of NG tube, nasogastric tube, from there that can also lead to invasion of microorganism. There are symptoms, so basic some symptoms are there that can prove that patient has VAP, like fever, purulent, any infection there can be fever. So there is a most foremost symptom, that is fever. Next, purulent sputum. So purulent sputum, you can see in the image that the color of the sputum became changed, that is yellowish greenish color of sputum, and that is thick in nature. So then leukocytosis, increased WBC count more than 11,000 cells per microliter in adults, and a progressive infiltrate on the chest. So you can see in the chest x-ray, so there is whitish patches in the chest x-ray, so that shows the infiltration in the chest, means infection in the chest. Then worsening oxygenation, so patient in the mechanical ventilation, but the patient's oxygenation became deteriorating, means when you doing the ABG, you can see the in the ABG report there is decreased PaO2 value, decreased SaO2 value. So that can give the hints that patient may have VAP. So that is a checklist. So you can see in the ward, every ward, so there is basically in the critical care unit, uh, so there is checklist for prevention of VAP. So basically there is some important notes is there. So you have to maintain non-touch technique, you have to maintain hand hygiene during suctioning, aseptic technique should be maintained. By the two person the suction should be done. One person doing the assay, then with the sterile technique, following the sterile technique, and another person will helping assisting the that person. And first we have to check that is the patient is ready for weaning or not. So every shifting the VAP is monitored. So VAP checklist should be filled up, that is morning, evening and night. So every shift we have to check that the patient is ready for wean or not, so we have to check for that. So we have to check the spontaneous breathing trial should be performed on the patient, and check for that patient is ready to wean or not. Next, the suctioning should be done by maintaining acidity, and every sip the suctioning should be done, and the patient should be keep on 30 to 45 degree angle. The bed should be on 30 to 45 degree angle, that prevents the aspiration. So, and the cup pressure should be from 20 to 30 centimeter of H2O pressure. So we have to every shift the staff nurse or caring healthcare provider of that patient should be checked the pressure, is that cup pressure is in normal range or not by the cup manometer. Okay, so cup pressure is important because if the cup pressure is not in the proper range, so that can cause the dislodgement of the ET tube. So we have to check for that, and we have to every shift the nurse should check the daily sedation gap, the sedation hold, or 30 minutes of sedation hold should be there to check the patient is reviving, patient is regaining the consciousness, or patient is regaining the reflexes or not. So we have to check for that. So those are the preventive checklists that should be performed by the staff nurse. And so this is the preventive measures. And when the VAP is developed, if the patient has developed the VAP, so in that case, so there is broad spectrum antibiotic, that is penicillin group of drug we have to administer to the patient to manage that condition.